Hello, and welcome to the inaugural Designing in Digital Health webinar. We're glad you could join us this afternoon or this morning if you're on the West Coast. I'm your host, Jonathan Follett, and with me is my co-host, Aaron Horowitz.
Hello.
So this is our first webinar series exploring the future of healthcare. If you have comments or questions for any of our speakers today, please tweet using the hashtag DesignDH. So that's DesignDH, and we'll be having a Q&A session with all of our speakers shortly after their talks. Designing in Digital Health is sponsored and produced by the folks at Involution Studios and Sproutel, who've teamed up to create 3 short presentations about key insights and learnings from the field. I'm from Involution Studios, where we're known for our approach to healthcare user experience design. We design, build, and ship beautiful software for companies of all sizes, from the market leaders of today, like Apple, Johnson & Johnson, and Partners Healthcare, to the micro startups that will create the markets of the future. And Aaron's going to tell us a little bit about Sproutel.
And hi, I'm Aaron. I'm the co-founder and CEO of Sproutel. And Sproutel is an R&D studio really focused on creating innovations in kids' health. We leverage a patient-centered, empathy-driven design process to create products, content, and experiences for kids who are facing some of the most complex medical challenges. And we do this by leveraging the power of storytelling and play to help comfort kids and educate them about their health. We're best known for our first product, Jerry the Bear, an interactive teddy bear you're going to learn a little bit more about in a little bit. Now, since this is our inaugural Designing in Digital Health, John and I wanted to really set the stage by defining what it actually means when we say designing in digital health. And so we're going to break it down a little bit and first just start with the word design and what it means when we say design. So when I say design, it might conjure images of sleek cars, of elegant home goods, maybe evocative chairs, some of the things that are peppered across the top of this slide. And while those are certainly all examples of design, when we talk about design, we're talking about it in a slightly different context. We're talking about design as a process, and design as a process to solve real problems that real people are experiencing. So the bottom half of this slide has some examples from tactile watches that help people without sight to tell time, to the Embrace baby blanket that helps incubate premature babies in developing countries. These are really all examples of the design process being applied to a problem that somebody is facing. Now, what better kind of place rife with problems than healthcare? And so really, this webinar will explore design's purpose in digital health. And when we say digital health, we're talking about kind of this convergence of all of these technologies that have been developed for consumers, from wearables to social networking to large amounts of data, migrating over into the healthcare space. And as you can imagine, that's quite complex. You know, we've seen so many of these transition over, and as this is happening, what's really important is to think about the patient and ultimately how design can be leveraged to take these really innovative technologies and implement them in ways that drive improved outcomes and improved care for the patient. So I'll kick it back over to John, and he'll take you through some of the different contexts that we're going to look through when we talk about designing in digital health, as well as introduce the presenters for today.
Thanks, Aaron. So when we're talking about design in digital health, we wanted to contextualize that conversation within industry, so how hospitals, healthcare systems, and physicians, how digital health is going to change the way they operate and function. We want to talk about emerging technologies, so how wearables, the Internet of Things, and genomics will be altering our health in the years to come. And finally, we want to look at the economic perspective, how we can manage the costs, the ever-rising costs of healthcare, and ultimately make healthcare more affordable. So today, I'm very excited because we have three fantastic speakers for you, and kicking off our first talk in the first Designing in Digital Health is going to be Dr. Joyce Lee, who's also known as Doctor as Designer. She's an associate professor at the University of Michigan Medical School and School of Public Health. She conducts clinical and outcomes research focused on children with obesity and diabetes, leads local and national quality improvement initiatives focused on individuals with type 1 diabetes, provides clinical care for children with diabetes at Mott Children's Hospital, and applies the methods of design and participatory design through her work with Health Design by Us. She has over 80 peer-reviewed publications, is the recipient of multiple NIH grants, and serves as the social media and web editor for the peer-reviewed journal JAMA Pediatrics. If you're interested, you can follow Joyce on Twitter at Joyce Lee. That's Joyclee. And you can also find out more about her at drasdesigner.com. Joyce will be talking with us about patient experts, design technology, and the maker movement. I'm very excited that Joyce is here with us today. Joyce, please take it away.
Thanks. You guys can hear me, right? So let me just go to full screen. So thank you guys so much for having me. Really appreciate it. I love hanging out with designers. So excited to be here. So those are my disclosures. Just wanted to start out with the model. I live in a world that pretty much doesn't even realize that there's this whole kind of industry called design. So I think on one end, when you think about designing in healthcare, there's this whole notion of blaming the user, and that's what we tend to do a lot in healthcare. I am really interested in sort of the human-centered design process, but even more importantly, I'm interested in this notion of participatory design. How do we co-design with patients and caregivers? But I think this sort of whole idea of meta design, of sort of patients and caregivers as designers, is probably the most compelling model that I've seen so far for creating interesting and important digital health solutions. In terms of meta design, so this is something that was new to me. It's something that my human computing interaction colleagues introduced to me, but it's this idea that users are co-designers and co-developers. They have the problems, but they also find the solutions. And I think the maker movement, which you guys are familiar with, right? It's a do-it-yourself technology movement that emphasizes learning by doing in a peer-to-peer setting. It's a model, I think, for meta design that I think could be really interesting and useful for healthcare and the design of digital healthcare technologies. So I want to just tell you a little bit of a story that's been happening inside our community. This is a commentary that we published in JAMA. Happy to share that with you if you email me. But basically, it's an amazing story of a maker movement inside the type 1 diabetes community, which is the clinical community that I work in.